Hello, my name is Jennifer Phillips. I'm a nurse practitioner student at Maryville University. This is Megan. She's going to assist me in the cardiac and the respiratory assessment. She is 32. And for this exam, we will not be removing the shirt, but in a normal situation, I would, of course, the patient would be disrobed and demurely covered. Okay, so first we're going to do, I'm going to palpate her chest to make sure, that there's no abnormalities, any kind of growths or tenderness in her chest. Trachea's midline. Sternum is even. Found her clavicular notch. Sternum. Are you having any pain when I push?
No.
Okay. All right, next we're going to do, have you lean forward a little bit. Just go ahead and cross your arms. Okay, and then any tenderness when I push?
No.
Okay, awesome. You can just sit regular. The next what we're going to do is I'm going to find your what's called your apical impulse. So first I'm going to have you, if you wouldn't mind, lifting your left breast for me. And then I'm going to go start here and move over to your mid clavicular line around the fifth intercostal space. I do feel the pulse of the maximal impulse here. It is light, it's no bounding, no heaves, and no lifts. Okay. I'm also going to have you go ahead and lay back for me. Okay. And can you lay on your left side for me? Yes. We're just going to go ahead and do this again. It's a better way to find the maximal impulse. She's going to go ahead and lift her breast, and I'm going to come here, put a little pressure. All right, good. No bounding, no heaves, and no lifts. Don't feel a thrill, just a nice steady pulse. Sit back up for me. We're going to get our exercise in today, up and down. All right, so next one I want to do is check for jugular vein distension. So I'm just going to have you lay straight back for me at this angle. All right, so I would like you to look to your left there. Let me get some tools real quick. Got them. All right. So this. Her pulse right here. It is about 1 centimeter, so that's nice and normal. Let me just feel. I'm going to feel a carotid pulse too. Got her nice and strong. Jugular disappears whenever I put pressure on it, so that means that's the jugular and not the carotid. Okay. All right, next I'm going to percuss. So just pardon me while I'm going to look at where your heart is sitting. Okay. So first I'm going to start this mid-axillary area and come across, okay? Would you mind lifting your left breast again? Thank you. This is how it works on a female. You got to make adjustments. Right here. I went from resonance to a dull sound, so this would be the left border of her heart. And then the right is normally just to the right of the sternum, but kind of hard, a little bit harder to hear with breast tissue. But if she were disrobed, it'd be a little bit more evident. All right, so the next thing we're going to do is I'm going to listen to your heart, okay? So first I'm going to do the apical. I'll do the pulmonic, do the second pulmonic, pardon my reach here. I'm also going to listen right here with the bell of the stethoscope, see if there's any murmurs. She's got a good S1 and S2. I'm just going to kind of right underneath again, thank you, to get that mitral. Okay, and let me come back up here because I did not check your S1. The S1 coincides with the carotid pulse. There's no murmurs, no gallops, No extra heart sounds, no S3 or no S4. Okay, so I think that concludes the cardiac portion, and we're going to move on to respiratory.
Okay.
Again, I'm going to have you take a deep breath in. We're really getting to know each other today. All right, good. Nice even chest expansion. Okay, go ahead and take a deep breath. Awesome. And one more for me. Okay. Now I'm going to check for the, here, good deep breath. Nice even chest movement. My thumbs went straight apart and back together. Unilaterally, or bilaterally I should say. Next, okay, we already did, she's got her tracheus midline. Like I said, she's got her clavicular notch here, and then her clavicle itself. Chest looks even, there's no barreling, there's no distress noted, no abdominal accessory muscles are being used. Rate and rhythm, I mean, it's even rhythm, there's no cough. The rate is probably about 16 at the moment. The next, what we're going to do is any audible sounds. I don't hear any wheezing. I don't hear any adventitious sounds that are abnormal, just nice and clear breathing. The next we're going to look at is crepitus, which is if there's any air trapped underneath the skin. So I'm just going to feel a little bit. Nice smooth skin. Nothing hiding underneath there. Okay, so next we're going to check Fremitus. So I'd like you to say 99.
99.
Nice and even. I can feel it vibrating both sides of her chest. Next is percussion. So I'll be tapping you tons of places on your back and under your axilla.
Okay.
Okay. All right. So when I do this, I'm looking for resonance, which means a nice kickback sound. And we go side to side to compare it to the other side. See if there's any difference. All right, nice, good resonance. It was long. It was direct. It didn't have a lot of extra sounds when I hit it. It was hollow sounding. That's what I'm looking for. It's hollow is what the resonance means. When you get to dull sound, that means you're over another organ. Okay, so now we're going to do the Diaphragmatic Excursion, which is a measurement. So let me get this. So what I'll do is I will percuss. I'll have you take a deep breath in and hold it. Okay, dull sound right about here. Okay, you can breathe normal. Breathe in. Okay. Then, so get a nice little notch there. Okay, so then I'm gonna have you exhale out as much as you can,
okay,
and hold your breath.
Okay.
Okay. 1, 2, 3. Right. Okay. So I got these two, and I made that one there. So it needs to be less than 3 centimeters. Oh, my measuring stick here. And we are at 2. So that's good. And we would do that on both sides just to mark where the diaphragm is. Okay. All right. I will auscultate her lung sounds. I'm going to start on the anterior portion. Deep breath. Go ahead and breathe in through your nose, out through your mouth. Deep breath. I'm going to go ahead and listen under here. Deep breath. Don't hear any sounds but clear air moving through. All right, deep breath. In and out. Okay. All right, now I'm going to check you. I would like you to say 99, and it'll tell me if you have any other airway issues.
99.
Again?
99.
Again?
99.
Okay.
99.
Okay.
99.
And one more.
99.
All right. Heard equally in all of these sounds in the areas that I listened to. All right, so the vocal resonance is great. That concludes our assessment of the cardiac and the respiratory system. Thank you, Megan.